Developing news now, a little girl from New England being treated for the enterovirus has died. The victim was from Rhode Island and suffered complications that sadly led to her death. Our Heather Hedges is live in Cumberland, Rhode Island with details tonight. Heather?
And health officials here are saying it was actually the combination of both a staph infection and enterovirus D68 that contributed to this girl's death. This health director stressing that this is an extremely rare combination, but that this combination can be extremely dangerous both with adults and children. And in this case, it was a child who died. Now, the school department here in Cumberland, Rhode Island tells us the student was a 5th grader here at Community Elementary here behind me, only 10 years old. It's not clear exactly when or where this student contracted the infection, but we can tell you that she was only in the hospital for 24 hours and died not this past Monday, but the Monday prior to that on September 22nd. Health officials also say only a small portion of people who contract enterovirus D68 will experience anything beyond a runny nose or fever. But as you know, this particular strain has been responsible for sickening at least 472 people in 41 states so far, and it has been particularly problematic with children with asthma. It can lead to breathing problems. Dr. Fine of the Rhode Island Health Department says this Cumberland girl died from a staph infection. That is what she died from, but he says the fact that she had enterovirus D68 certainly did not help the situation, although right now it's not clear exactly how much the enterovirus contributed to her death. Take a listen.
It's not clear, what role the enterovirus had, but clearly the death was a sepsis death. This is an overwhelming and tragic infection which happens sometimes after viral infections of various descriptions, and sometimes even happens without viral infections. And it is, from an infectious disease perspective, really a perfect storm. The combination of Staph aureus and D68 is very rare. This is an isolated case, and which obviously led to a tragic outcome, but is not something we expect to see again.
And tonight, the Cumberland School District releasing the following statement to parents, talking about how they are going to leave no stone unturned, and they're going to be cleaning every classroom just as a precaution, saying that they do that anyway, but they're going to specifically be doing it because of the death of one of their 5th graders. The health department stressing that people should be urging their children to wash their hands 5 or 6 times a day. Also saying it's important, this is the time of year to get your flu shot. While that's not exactly related to enterovirus D68, they wanted to urge the public to do so as well. That's the latest in Cumberland, Rhode Island. I'm Heather Hedges, Fox 25 News.
Heather, thank you. Also developing